Erectile dysfunction is a condition that affects millions of men worldwide, regardless of age or background. Often misunderstood, erectile dysfunction is more than just an occasional difficulty in achieving or maintaining an erection. It can impact self-esteem, relationships, and overall quality of life. Many men hesitate to seek treatment, thinking it's just a passing issue, but recognizing the symptoms is the first step toward effective management. Erectile dysfunction deserves open and honest discussion, breaking the stigma and offering clear information. There are several causes of erectile dysfunction, ranging from physical to psychological factors. Sometimes, underlying health issues like diabetes, high blood pressure, or cardiovascular problems can lead to erectile dysfunction. In other cases, emotional stress, anxiety, or depression may play a significant role. Identifying the root cause is essential for choosing the right treatment for each individual. When it comes to treatment, knowledge truly is power. When talking about erectile dysfunction, two names always stand out: Viagra and Cialis. These medications have become household names and are widely recognized as leading options for treating erectile dysfunction. The popularity of Viagra, sildenafil, and Cialis, tadalafil, comes from their proven efficacy and widespread availability. Each has its own characteristics, and understanding their differences is key to making an informed choice. Symptoms of erectile dysfunction are often easy to identify but not always easy to talk about. The main sign is consistent difficulty in achieving or sustaining an erection sufficient for sexual activity. However, symptoms can also include reduced sexual desire or confidence issues related to performance. Addressing these symptoms early increases the chances of effective treatment and improves overall well-being. For many, seeking help is the hardest part. But it's important to remember that erectile dysfunction is a common condition with several effective treatment options available. Whether through lifestyle changes, counseling, or medications like Viagra and Cialis, there is a path forward. By understanding the causes and symptoms, individuals can feel empowered to take control of their sexual health. So if you're ready to break the silence and find the best treatment, make sure to subscribe to the channel right now. Here, you'll get clear, honest, and practical guidance on erectile dysfunction, treatment options, and everything you need to know about Viagra and Cialis. The process of achieving an erection is a remarkable feat of human physiology. At its core, an erection starts with sexual stimulation, which signals the brain to release chemicals that relax the muscles in the penis. One of the key players in this process is nitric oxide, which helps dilate blood vessels and allows increased blood flow. Understanding how an erection works provides a clearer view of why erection problems can happen. When everything functions properly, the penile tissues fill with blood, causing the penis to become firm. Blood vessels that supply the penis expand, while those that drain it constrict. Another important molecule, cGMP, helps maintain the erection for as long as needed. If there's any disruption in this chain of events, erection problems may arise, showing just how delicate this balance truly is. Several factors can interfere with this process, and they are not limited to age or lifestyle. Chronic conditions such as diabetes or heart disease often impact blood flow, directly affecting how an erection works. Other times, nerve damage or hormonal imbalances are to blame. It's important to remember that both body and mind work together, so stress or anxiety can also contribute to erection problems. It's also common for men to experience occasional difficulties, which is entirely normal. However, when erection problems become persistent, it may signal a deeper health issue. Recognizing these warning signs early and seeking guidance is essential for effective treatment. Taking this step brings both relief and clarity about the best steps to take. The role of the mind should never be underestimated. Emotional stress, past experiences, or relationship issues can influence how the body responds during intimate moments. Addressing these psychological elements is just as important as treating physical problems. When seeking solutions, it's vital to look at the whole picture, not just one aspect. With a solid understanding of how the body works and what can go wrong, you're better equipped to explore treatment options. In the next section, we'll dive into how Parade 5 inhibitors work and why they make a real difference for those facing erection problems. Parade 5 inhibitors have revolutionized the treatment of erectile dysfunction, giving hope and real solutions to millions of men. These medications work by targeting a specific enzyme in the body called phosphodiesterase type 5, Parade 5. Understanding the mechanism of action behind these drugs explains why they are so effective in treating erection problems. The discovery of Parade 5 inhibitors marked a new era in sexual health and medical science. The Parade 5 enzyme is naturally present in penile tissues and plays a vital role in regulating blood flow. Normally, this enzyme breaks down cGMP, the molecule responsible for relaxing blood vessels and supporting erections. By inhibiting the Parade 5 enzyme, these medications allow cGMP to remain active longer, sustaining the blood flow needed for a firm erection. This is the basic mechanism of action behind both Viagra and Cialis. Sildenafil, Viagra, and tadalafil, Cialis, are the most well-known Parade 5 inhibitors. Despite sharing the same core function, each drug has unique properties that affect how and when they are used. Their effectiveness comes from how they block the Parade 5 enzyme, making them dependable choices for erectile dysfunction. Many men experience significant improvement after starting treatment with these medications. The science behind Parade 5 inhibitors is both simple and powerful. By targeting the Parade 5 enzyme, they remove one of the main obstacles to achieving an erection. This approach treats the root cause of the problem rather than just masking symptoms. Men who use Parade 5 inhibitors often report increased confidence and relationship satisfaction, benefits that extend far beyond the physical. Doctors worldwide trust these medications due to their proven safety and efficacy profiles. Understanding their mechanism of action can help patients feel more comfortable with treatment and encourage them to follow medical recommendations. The clear, evidence-based science behind Parade 5 inhibitors sets them apart from unproven or risky alternatives. Next, we'll take a closer look at sildenafil, Viagra, its key characteristics, proper usage, and why it's one of the most popular choices among Parade 5 inhibitors. Sildenafil, widely known as Viagra, is one of the most recognized medications for erectile dysfunction. Its effectiveness and popularity make it a first-line treatment recommended by doctors around the world. Understanding how sildenafil works, how long it lasts, and how to use it correctly is essential for men seeking real results. Careful attention to the package insert ensures both safety and optimal benefit. When considering treatment, a common question is, how long does Viagra last? Typically, sildenafil starts working within 30 to 60 minutes, and its effects can last about 4 to 6 hours. For best results, it's advised to take the medication on an empty stomach or after a light meal, since fatty foods may delay its onset. Always read the package insert and follow medical advice for safe and effective use. The usual starting dose of sildenafil is 50 milligrams, but adjustments can be made based on your individual response and any side effects. Never exceed the maximum recommended daily dose indicated in the package insert. Viagra is most often taken as needed, around 1 hour before planned sexual activity, which adds convenience for many men. To maximize results, it's important to know exactly how to use sildenafil. Consistency in timing, avoiding excess alcohol, and leading a healthy lifestyle all contribute to better outcomes. If you find this content helpful, consider joining our channel's member club and smash that super like to help keep the channel running. Besides its primary use for erectile dysfunction, sildenafil is sometimes prescribed for other conditions related to blood flow. However, it should only be used under a doctor's supervision. Proper understanding of how to use Viagra responsibly is the foundation for safe and successful treatment. Everyone responds differently, so regular follow-up with your healthcare provider is recommended. Monitoring for side effects and dose adjustments can make the treatment journey smoother. In the next section, we'll dive into tadalafil, Cialis, comparing its unique features and how it stands apart from sildenafil. Tadalafil, better known as Cialis, stands out for its long-lasting effect and unique dosing options in the treatment of erectile dysfunction. One of its main advantages over other medications is its prolonged action, which offers flexibility and convenience for many men. Understanding how long Cialis lasts and the benefits of daily use can help you decide if this medication fits your lifestyle. A frequent question is, how long does Cialis last? Unlike sildenafil, tadalafil can remain effective for up to 36 hours, which has earned it the nickname the weekend pill. This extended duration allows for greater spontaneity and less need to plan intimate moments, an important advantage for couples seeking a natural experience. Always refer to the package insert for detailed guidance and recommended practices. Tadalafil is also available in a daily use option, a low-dose regimen that keeps the body ready without having to schedule medication around intimacy. This can be especially useful for men who prefer spontaneity or have frequent sexual activity. Before starting daily use, consult your healthcare provider and read the package insert to ensure safe and effective treatment. For many men, taking a pill every day is more convenient than planning ahead for each encounter. Discuss with your doctor whether daily or as-needed dosing best suits your routine and health profile. The daily use of Cialis has also shown benefits for some men with urinary symptoms related to prostate issues, further broadening its application. Tadalafil's flexibility, in both dosage and duration, makes it a popular and widely chosen option worldwide. Whether you prefer a single dose or daily use, always follow medical recommendations and never exceed the prescribed amount. Understanding the package insert and your doctor's instructions helps prevent complications and ensures the best results. Next, we'll explore clinical efficacy and patient satisfaction. Stay tuned as we compare real-world results, so you can better understand which treatment delivers the best outcomes for erectile dysfunction. When choosing the best treatment for erectile dysfunction, the question of efficacy is always front and center. Clinical studies have shown that both sildenafil and tadalafil deliver high success rates, with more than 70% of men reporting improved erectile function. This comparison isn't just about numbers. It's about understanding what works best for each individual based on personal lifestyle and medical needs. Sildenafil is known for its rapid onset, usually taking effect within 30 to 60 minutes after intake. Tadalafil, on the other hand, may take slightly longer to reach its peak but stands out for its prolonged duration. Clinical studies indicate that both options are highly effective, but the longer window provided by tadalafil gives some men more freedom and flexibility. This aspect often emerges as a deciding factor when comparing which is better for long-term satisfaction. Beyond the statistics, patient satisfaction depends on real-world outcomes like confidence, spontaneity, and relationship quality. Both medications have been shown to enhance these aspects, with many men reporting greater ease and naturalness in their intimate lives. Tadalafil's extended effect is particularly valued by couples who prefer not to schedule intimate moments. This level of flexibility often tips the scale in its favor in user reviews and clinical studies alike. While both drugs perform strongly in head-to-head trials, the choice often comes down to lifestyle preferences and tolerance. Men who prefer planning may choose sildenafil for its shorter window, while those seeking ongoing readiness might opt for tadalafil. Discussing these details with a healthcare provider helps align treatment with daily routines and expectations. It's also important to consider safety and adherence. Efficacy isn't just about results. It's about comfort, consistency, and long-term use. Men who experience fewer side effects are more likely to stick with their medication, which directly improves satisfaction and outcomes. This makes open communication with your doctor crucial in finding the best fit. Next, let's take a closer look at the side effects and risks associated with these medications. Knowing what to expect is an essential part of choosing a safe and reliable treatment for erectile dysfunction. Understanding the side effects and risks of any medication is essential for safe and successful treatment. Both sildenafil and tadalafil are generally well tolerated, but some men may experience mild to moderate side effects. The most common side effects include headache and muscle pain, which usually go away on their own and rarely require medical intervention. Knowing these possibilities helps set realistic expectations and supports overall safety. Other frequently reported side effects are facial flushing, nasal congestion, and digestive discomfort. These are typically short-lived and resolve as the medication wears off. Most men find these effects manageable, but it's important to read the package insert carefully and consult your doctor with any concerns. Taking these steps minimizes risks and ensures you're using the medication responsibly. A smaller percentage of men may encounter more pronounced reactions such as changes in vision, back pain, or dizziness. Although these effects are rare, they should never be ignored. Any severe or sudden symptom requires immediate medical attention, especially if it disrupts your daily life or causes significant discomfort. Safety should always be your first priority when dealing with any medication. On very rare occasions, both sildenafil and tadalafil can lead to prolonged or painful erections, a condition known as priapism. This is a medical emergency and requires prompt intervention to avoid long-term damage. Both drugs can also interact with other medications, especially those used for heart conditions. Always inform your healthcare provider about all medicines you use to prevent serious interactions and keep your treatment safe. Headaches and muscle pain are the most common complaints, but simple strategies like staying hydrated and resting can help manage them. For those who are especially sensitive, discussing alternative dosages or options with your doctor can make a difference. Regular communication with your healthcare provider is key to minimizing risks and ensuring continued safety. Next, we'll discuss contraindications and drug interactions, important details you should know before starting any new treatment for erectile dysfunction. Before starting treatment with sildenafil or tadalafil, it's crucial to understand their main contraindications. Some health conditions make the use of these medications unsafe, regardless of the degree of erectile dysfunction. The most important contraindication involves the use of nitrates, drugs commonly prescribed for chest pain or heart disease. Combining nitrates with parade 5 inhibitors can cause a dangerous drop in blood pressure, putting your safety at serious risk. Severe heart or liver disease is another major factor to consider. Men with recent heart attacks, strokes, or unstable angina should not use these medications unless cleared by their doctor. Always review your complete medical history with your healthcare provider to ensure a safe and tailored approach. Safety must always be the top priority when choosing any treatment for erectile dysfunction. Interactions with other medications can also present significant risks. In addition to nitrates, certain blood pressure medicines, antifungals, and antibiotics can interact with sildenafil or tadalafil. It's vital to inform your doctor of all drugs and supplements you're taking. Careful review of your medication list reduces the chance of serious interactions and ensures your safety. Some men with rare eye diseases, such as retinitis pigmentosa, should avoid these medications. Severe kidney disease or known allergies to any component are also clear contraindications. Reading the package insert and having a thorough discussion with your doctor are your best defenses against potential risks. A comprehensive pre-treatment evaluation is essential for anyone with complex health conditions. Your doctor can personalize recommendations based on your health profile, maximizing benefits while minimizing danger. Never start, stop, or combine medications for erectile dysfunction without professional medical supervision. Next, we'll look at practical criteria for choosing between sildenafil and tadalafil, plus tips on how to talk to your urologist about what fits your needs best. Choosing between sildenafil and tadalafil can feel overwhelming, but some practical criteria make the decision easier. When considering which to choose, think about how often you plan to have sexual activity, your need for spontaneity, and how you respond to each medication. This type of comparison goes beyond the basics and helps you decide what truly fits your life. Duration of action is a key difference. Sildenafil typically provides a window of 4 to 6 hours, which is best for those who can plan ahead. Tadalafil, however, lasts up to 36 hours, making it ideal for those who value flexibility and ongoing readiness. Understanding these differences is crucial when figuring out how to decide on the right treatment for you. Dosing preferences also play a big role. If you'd rather not take a pill daily, sildenafil is likely the better fit. For those who prefer being ready at any moment, tadalafil's daily option might be more appealing. Both medications are effective, but your daily routine and comfort level should guide your final decision. Side effects and health history are equally important. Some men tolerate one medication better than the other, so your past experiences matter. Always bring up these details during consultations to receive the best possible medical guidance. Your doctor will consider all aspects, including other health conditions and medications you may be taking. Open and honest communication with your urologist ensures a personalized approach. Discuss your goals, ask questions, and be upfront about your expectations. With the right medical guidance, you can confidently choose the treatment that aligns with your needs and lifestyle. Up next, let's address the most common questions and myths about Viagra and Cialis, so you can separate fact from fiction and make truly informed decisions. Before we answer the most common doubts, don't forget to join our member club, hit that super like, subscribe to the channel, and share your opinion in the comments. Your support helps keep this channel running and brings reliable information every week. One of the most frequently asked questions is, can you take Viagra or Cialis every day? The answer depends on the specific medication and your doctor's advice. Tadalafil can be used daily at a low dose, while sildenafil is typically taken only as needed. Always follow your doctor's recommendations and never self-medicate, regardless of what you might read online. Questions about Viagra and Cialis should always be discussed with a healthcare professional. A common myth is that mixing these medications leads to better results. This is not true and can actually be dangerous. Combining two parade 5 inhibitors increases the risk of side effects without any additional benefit. Knowing the difference between truth or myth is crucial. Stick to proven treatments and talk to your doctor if you have doubts. Some people worry that these drugs may harm the heart. For most men in good health, Viagra and Cialis are safe when prescribed by a doctor. However, those with serious heart problems or who take nitrates must avoid these medications. Your doctor will provide the best guidance based on your personal medical history. Another frequent myth is that Viagra or Cialis cause addiction or permanent harm. Scientific evidence shows that when used as directed, there is no risk of dependence and no lasting damage. Truth or myth? In this case, it's just a myth. Rely on scientific data and trusted sources when making decisions about your health. Curiosity about new treatments, natural alternatives, and lifestyle tips is also common. Not all advice you hear is accurate, so always check with a medical professional before making changes. Well-informed patients have better outcomes and greater peace of mind, so never hesitate to ask questions about Viagra, Cialis, or any aspect of erectile dysfunction treatment.